So, Spencer, do you want to give me a little update about your clients this week?
Yeah, this week we had a chat with the FDA. We did an FDA pre-submission. If anyone doesn't know what a pre-submission is, it's a way to communicate with the FDA ahead of time about your product and understand if your regulatory strategy is correct, if you're running a clinical study, if the number of samples, or sorry, the number of subjects that you have in the study are good, if you need more or less. So it's a way to get really early feedback from the FDA prior to submitting your actual 510(k) or that kind of thing. So I always recommend that people do them. Depends on your product code, your predicate, a lot of different things, but it's a great way to communicate with the FDA. I actually wish that they did this a little bit more in the EU under MDR and IVDR, but it was an interesting experience. I think, when you chat with the FDA, you come in expecting things to be exactly like you would think they would be from reading approved devices and the regulations. And sometimes the FDA will come back with a different flavor of their interpretation of what the regulations actually mean. So for us, it was essentially understanding FDA's viewpoint on a few product codes and predicates and adjusting our strategy according to that. But yeah, if anybody ever has questions on pre-subs, I'm always happy to answer them. We've done a lot over the years.